All right, guys, this is a big one. Are you pregnant right now and you want to have your baby without the use of pain medications in your labor, but you don't know where to start? Let me help you get there. So there's actually quite a few things that you can do to help you cope with the pain of childbirth that involves zero medications. But let's be real here, guys. Childbirth, that hurts. And if anybody says differently, they're very likely lying to you. But can we make it feel a bit better for you? Yes, we can. So my name is Tina B. I am a labor and delivery nurse, and I'm certified in perinatal nursing. And if this type of content interests you, go ahead and boop that subscribe button, because I really do miss you when you're not here. Now, Hollywood, they sort of show everybody going into labor and they are screaming and they are huffing and puffing and it is absolute chaos. But I'm telling you, it doesn't actually have to be that way. And the first two methods we're going to talk about, they are breathing techniques and visualization. So let's get into it. The first thing you're going to arm yourself with are breathing techniques. You have got to breathe well if you're going to get through this labor thing unmedicated. And there's actually different breathing techniques you can utilize through each different part of your labor. And if you look at that, I have a whole video all about this. So go ahead and click on that and watch it, and then come right back to me. Important to note about breathing, each breath needs to be purposeful and controlled because you're leaning on that breath to get you through that contraction and on to the next contraction and eventually lead you all the way up to your baby. And importantly as well, you have to practice breathing techniques. If you do not practice these ahead of time, you're likely going to resort to that Hollywood breathing, that huffing and the puffing, and that's going to drive ticket sales in the cinemas, but it is not going to do jack squat for your pain during labor because mindset is really important when you're getting through your birth without medications. Now, a really good time to practice breathing techniques is when you're having a poop, because I know that you're constipated because you're pregnant, but I assure you, you will have enough times in the bathroom making a poop to practice these breathing techniques really, really well and have them in your tool belt when you need them. Your next technique is distraction. Now, this is said to reduce pain and stress by distracting you from the pain of the contraction as it comes on, and it is as simple as it sounds. This could look like going for a walk or watching a movie or sucking on a piece of ice or a lollipop, which is why I talk about putting them in your hospital bag. It could also look like putting a comb in your hospital bag because when you have a contraction, you can put this comb into your palm and you can squeeze it. Now, this is said to work because of the gate control theory, which says if you flood your brain with less painful stimuli than when you have more painful stimuli, that painful stimuli has nowhere in the brain to go and it cannot register the pain as intensely as it was before you did that comb in the palm. Are you going to pack one of these in your bag? Let me know in the comments. The next one's a big one. Movement. Now, we know that movement in general during the labor process is really, really beneficial, but did you know that you can actually utilize movement as a method of pain control all on its own? Because here's what's up. When you're moving during labor, you're actually changing the angles of your pelvis, and when you do that, you're helping baby to be able to come down and engage, and that engagement is going to keep your labor moving forward because movement for you is motion for baby. So in this area, you're going to think about utilizing your birthing ball to do some hip circles and some pelvic tilts. And then you're also going to want to utilize your peanut ball and get into all sorts of really fun positions. That's going to change the angle of your pelvis depending on how high or how low your baby is. But we can't forget about upright positions, right? I mean, people have been upright in birth for centuries, but for some reason now, everyone's trying to cope with this pain while they're lying down. But what if we use your body's natural movements and gravity to help you with the control of your pain during labor? I came across a super cool product. This is called the Birth Sling. Check this out. It is miles of fabric that's used to support you during your labor. It comes with some hooks and you put those over top of a door and then you lock the door for safety and you can actually support your body weight in this sling and you can do rocking movements and swaying movements and you can be supported under your armpits to keep your body upright and keep your labor progressing and moving forward while being able to cope with your pain really, really well. Check out these beautiful pictures of this thing being used in the wild. It is absolutely a cool product and this color is chef's kiss. Movement can become a really powerful tool to help you cope with the pain of childbirth. Now, please don't forget to put a toilet on your list as more of an upright position because most people have access to a toilet, and when you're sitting on it, you're sort of in this sitting squatting position, but there's not excess pressure on your perineum. I can tell you from experience, a ton of people love the toilet for pain control in labor. All right, next up is focal point and visualization. Now, these two techniques, they're actually pretty differently, but if you practice them ahead of time, they can both be effective for minimizing your pain during your contractions. And they both utilize very similar to the gate control theory where you were squeezing the comb into your palm, but instead of that mildly painful stimulus, you're actually flooding your brain with information so that when the big pain stimulus of the contraction comes, there is much less place in your brain to go. When you use a focal point, it is exactly as it sounds. You pick one point to focus on when your contraction comes, and then you narrow in on that point and you don't leave that point until the contraction is over. And this can be as simple as a smudge on a window or a picture that you brought in or your partner's button on their shirt. Contraction comes, laser focus, breathe through it, contraction ends, and relax. That's using a focal point. Now, using visual imagery, that's almost the opposite, and I actually think it takes a lot more practice to use this one effectively. So when you have a contraction and the pain comes on, you are going to go inwards and you are going to imagine yourself in a place that brings you relaxation, or that brings you calmness, or it brings you peace, or you can actually visualize the process that you want to have happen. So you could see yourself at a beachfront property if that's what does it for you, or you could see yourself holding your baby, or you could visualize your cervix opening, or a flower blossoming. Whatever floats your boat, whatever gets you away from this and into this, that's what you're going to utilize for visualization. The next technique up is actually going to utilize another person. So your support person or a doula or your partner, because it is touch. Now, touch can be a really great way to distract you from the pain, to make the pain feel better physically, and also to connect you to what is going on with your partner and with your body. First thing you can try is massage. And this is pretty simple, but it is not the massage that you would expect at like the Shangri-La. This one is a more forceful, a more purposeful massage. You might want to think about packing a tennis ball or a massager into your bag, because those tools can be utilized to give a more effective massage, either in the back and the shoulders, definitely on the lower back, because that is where a lot of people hold that pain during their contractions. And that low back pain, it can really be helped by one of my favorite things on this whole list, counterpressure. Ding, ding, ding. If you take one thing away from this video, please let it be that counterpressure is very effective at helping you manage your pain during your contractions. Not one time have I ever been doing counterpressure on a patient and had them be like, no, I don't like that, or please stop. It is always, that feels so good, or please keep doing it. So counterpressure can be applied in a bunch of different ways. If you want a whole video on counterpressure, just let me know down below. I'd love to make it for you. But what you need to know is, for counterpressure to be effective, you are going to take the bony parts of your hands or your fists, and you're going to apply a strong downward force on the bony parts of somebody's lower back. And when you do this, you start when the contraction starts and you ease up as the contraction stops. When you're doing this, you are putting pressure on the bony parts, which is going to take away that tension in the ligaments of the uterus, and it is incredibly effective. Okay, this one could really make or break your unmedicated childbirth experience, but you need a supportive, invested support person. You would be surprised the number of support people that come to births, and they are about the farthest thing away from a support person that you could possibly imagine. And let me tell you something, when you're doing this unmedicated, you, more than anybody else, you need somebody there that is an active participant and that is there to be your advocate, because there's going to be parts of your journey that get really tough, both physically but also mentally. So you need those people that are there for you, and they are not just there for some time away to play PS5 or to be on their text messaging or on their social media. So pick the people there to support you in your birth very, very wisely. When talking about support people, if it's financially feasible for you, you may also want to consider bringing in a doula, especially a doula that is experienced in an unmedicated childbirth, because they can be there to support you and be an active participant and be an advocate for you, and they know tons of tips and tricks to help you get through each contraction that's going to lead you closer and closer to your baby. There's a really cool piece of technology. It's gaining popularity in the birthing space, especially with unmedicated births. It's called a TENS machine. Now, this little unit, it delivers low voltage of electricity to a targeted area on your body to help with pain. Now, this is usually on that lower back, but I've also seen it up in the shoulders if you have tension up there. And it works sort of following the same idea as the gate control theory of the comb, where you are putting less painful stimuli in place of the big painful stimuli, but this is also said to release some endorphins. Now, you might have seen this as little pads that are attached to wire that's attached to a pack, but I have found another really cool product. This one is called the Volt Pocket. It is basically a little mini TENS machine all in one. So you could grab onto this and you could toss this in your hospital bag if TENS therapy is something that you are into for pain control during labor. But you would be wise to talk with your provider about TENS therapy before you actually utilize it, and make sure that you are both on the same page about using this new technology for pain control. This list would not be complete without talking about aromatherapy, because utilizing your sense of smell can be a great way to distract you, but it can can also be a great way to heighten your birthing experience because you can utilize things like lavender for relaxation or peppermint if you're feeling quite nauseated. But with aromatherapy, you really have to check in with the site that you're going to be delivering at because a lot of places, they do have a scent-free policy. Hypnobirthing definitely holds a place on this list, but admittedly, I do not know a ton about hypnobirthing. So if you want to know more about hypnobirthing, let me know in the comments as well, and I will do it its due justice. But hypnobirthing involves a lot of the things we've already talked about. It involves controlled breathing and visualization, but it also includes things like positive affirmations and positive thoughts because the theory is if your mind and your body are both relaxed, then labor and birth can progress more quickly and more painlessly, and it can be a beautiful experience. Now, I did mention that at the end of this video, I would talk about something that I really, really love, and we are here water therapy. Now, important to note, a water birth and hydrotherapy, they are two very different things. So water birth, of course, is when you have your baby in the birthing tub, and hydrotherapy is when you utilize water to help you with pain control in labor. ACOG actually recommends against water birth where you actually have your baby underwater, but they do support the use of hydrotherapy in the first stage of labor for pain control. So let's chat about that. First thing you can do is you can get into the shower. If you have a nice strong shower head, that pressure of the water on your belly during a contraction can feel really good. And when you think about it, warm temperature water and the sound of water can also be comforting and can be relaxing. So in the shower is a great place to do some of your contracting. And if you're going to get into the tub, there are further benefits there as well. That warm water all around your body helps to relax your muscles. And then when you have your belly in water, it's actually a little bit buoyant. So it takes some of the pressure off of your hips and pelvis, and that can be so good for you as well. So if you are into water therapy, definitely get into the shower, definitely get into the tub, and check with your site you're going to deliver at to make sure that they have those resources available for you and let them know that you're going to want to use them again so they can have it all set up and ready for you to go. Okay, I hope you were taking notes, and now you have all of the things written down that you want to try for your childbirth without medication and that you will start to practice them very soon. Remember, mental preparation is important and you can do this. I had a great time making this one for you. Go ahead and give it that thumbs up, and I will see you in the next video. Bye.